Today, we're going to be serving up the diagnostic dish, and we're going to get the skinny on the Schirmer tear test. The Schirmer tear test was introduced in 1903 by none other than, I bet you can guess it, Schirmer himself. Now, there are two types of Schirmer tear test traditionally. There is the Schirmer tear test 1, which is the one that's employed within clinical practice the most, and it measures the trigeminal facial reflex tearing in addition to basal secretion. It's done without the use of topical anesthesia, whereas the Schirmer tear test 2 does utilize topical anesthesia. Now, the Schirmer tear test, as we just discussed, is done prior to the installation of any topical proparacaine, eye wash, fluorescein dye, or other dyes within the eye, and prior to any excessive manipulation of the eyelids or of the eyeball itself. You don't want to stimulate any reflex tearing and give us a false elevation of that value. So, the one caveat to that I will say is that you do want to try to get the mucus out of the corner of the eye, or as much of that mucus out as you possibly can. Take a little tissue or a cotton tip applicator or a cotton ball and see if you can roll that mucus out. You don't need to get all of it out, but just the bulk so that, again, that strip can go where it needs to and it can give us the result that we're looking for. Now, with that being said, when we take this strip out of its packaging, be careful not to touch the strip down towards the bottom. With your oils on your skin, that can influence that result. And then you're going to take that strip and you're going to put it in the ventrolateral conjunctival fornix out here towards the outer corner, run between the eyelid and the cornea itself. It does need to contact the surface of the cornea so that it is a true indicator of that reflex stimulation or reflex tearing. Putting the tear test strip in one eye does not seem to stimulate any reflex tearing in the other eye, so we don't need to worry about that influencing our results. I will say something about cats here. Don't do the test in cats. It's not a reliable indicator of their tear production. You can have a clinically normal cat that gives you a Schirmer tear test value of 5. So if you want to keep a few more fingers throughout your career, let's just leave cats out of the mix here. They'll be happier. Your hands will be happier in the process. When we do that test, what we're looking for is we want to see a value, ideally something over 15. Anything less than 10 is considered a true dry eye situation. Anything between 10 and 15, and again, this is in the dog, is considered a marginal level. And then anything over 15 is technically considered normal. Now, in the future, we'll talk a little bit about the quality of the tears and how, even though you get a normal tear production, you can still have poor tear quality. But we'll save that for another episode.